So when I was in Philippines, I graduated Bachelor of Science in Nursing. I studied for 4 years there, and I've been studying in Manila um, for 4 years. Oh no, initially I was from Tacloban for 2 years, and then in my nursing school, and then I was moved to Manila for another second year. So I graduated on 1992, and then went to work in a private hospital for, I think it was for exactly six months. And then when I got married, I have one child, and there was an opportunity that POEA has to give like fly now, pay later, or like work now, work later and then pay later. So it was like a salary deduction on where, because we have no money to pay for a placement fee. So I applied for that, and luckily I got in. But initially I worked in Singapore as a healthcare assistant for 1 year and 3 months. On that 1 year and 3 months, I was really really eager because I was missing my child, who was only I have like an 8-year-old and a 6 months old baby at home, and my husband. So we're just like getting married. So I was really finding a place where I can settle down, and I could bring them over and join me. And because when I was in Singapore, it's like, oh, the place is so nice, the food is great, the people are nice, and I wanted my family to experience that. And then it was like the top of like UK was like hiring nurses from Singapore, and they got like a lot of agencies there. So I was trying to get in, but because I was new, so it's like difficult to get in. And then one day, one of my colleague, was like my housemate, she asked me, I'm going for to sit down for an examination, going to UK. And I'm like, okay, you want to come? And I said, okay, let me go then. So I went, and into that examination, I was given the test paper on where my name is not there, but because I was sat there with my friend, so they've given me the test paper. So I took the exam. They asked me why I was there during the examination, and I just told them that I was given the test paper, so I have to complete it. So they said, that you rank second, so we have no choice, but we're going to put you in the list for interview if one of the hospital will ask for people to go for interview. So, but then it was like for me, like it's like a long wait. So I'm like the one who is keep on bugging them and, okay, hey, when am I going to be like in the interview? And then okay, they said that okay, we're going to do this like a test interview. So I sat down with them, and they said, oh, they were saying that, oh, you're not yet ready. And then, but because I'm really eager, because I really wanted to come over and to be with my family, because I was really missing them a lot. Because all my salary is like going into the phone calls, phone bills they have to pay, because I have to call every day. So I'm like, oh, come on. And then I'm always praying. So what I did was like I was writing all, like they said, okay, they've given me a question. I have to write them, and then I will answer, and I write that in English, because like in expressing in English, it's quite difficult. So I wrote it down, and before I go to sleep, I have to read it, and I wake up, I have to read that notes. So they asked me that, oh, somebody has phoned us and say that they're needing somebody. We're going to put you in the interview, and this hospital is in the near the city. And I said, okay, that's fine. So I was booked for the interview. I went, and then after the interview, like they ask you, do you have any questions? So the only question I have in mind is, are you taking me? So, and then they said, yes, yes, you're very good. So we're taking you. And I'm like, oh my God, thank you. So I was like shouting, and then I was jumping for happiness. And then they said, you can like process all the papers. And they said in a couple of months, you can fly to the UK, paid of everything, because the hospital has paid everything. And I was so happy. I was so thankful. So we do the processing, and then with the visa thing, I have no money. So one of my friend, she used her money as a show money, because when you apply for a visa in Singapore coming to UK, you've got a show money. So she got a show money in her bank, and then after that she photocopied that, and then she moved the money to my bank. So we photocopied the paper so that we can just show that there's money in there, but actually it was my friend's money. But I was so really pleased. So it was like I think it was only like 2 to 3 months before I flew over, and then what happened? Yeah, so we were welcome here, and we were like, because our hospital in Singapore is like very high tech. We've got like robotics things and all this drip machines. We all have that in Singapore, so we are not like new to that. So when we join over, and then I think that the Rumo pump, they were just introducing that here when I arrived. So they don't know how to. It was bleeping, and you're like, oh, what's that bleep? And I said, I think it's the machine. So they said, oh, you know how to do? I said, yeah, because that's what we're using in Singapore. So we were like, we were imagining UK was like high tech and very progressed, and then when we come to the hospital, it was like a small hospital, and it we were like, oh, this like anyway, it's in UK, so let's enjoy it. And then even in Singapore, my saying was like, oh, I think I'll be better in the UK, because the people who's going to bully me, the nose is taller than mine, and they are whiter than me. So I think I will be okay with that. So this is the thing, because in Singapore, like the Malay people, especially if they're like higher in your rank, they look down on you as well. So they treat you, as if that you don't know anything. So anyway, so we joined over here. So I was quite settled. So after 3 months, I applied for a mortgage. I was so that desperate to bring my family over, because they said it was a requirement at that time that we should have a house of my own so that my family can go over. So 3 months I applied, and all my friends were like saying, my colleagues were saying, "Oh my God, you just knew. You don't even know if you could pass the, how do you call that before? Like to get the license, adaptation, yeah. So you don't even know if you could pass the adaptation." But I said no. I said I will do my very best to pass this adaptation, because I'm really desperate to bring my family over. I'm really missing them. So in within 6 months, so I got the mortgage. I've got like a three-bedded little house, and my husband joined me in 6 months' time, together with my baby. So I was so very very happy, and I was pleased. But during my work, of course, initially, English was like difficult to adapt. Like especially the slang words. Like, but initially they trained us just to say, like spent a penny, loo. So we have those words given to us when we arrive. Applying the visa is have a big impact on my side, because I have to be a good girl and just follow whatever they tell me. So I have no reason to fight back to them, because I am desperate for this. So whatever they tell me to do, I have to do it. If even if you like one of my friend are like feeling sick, and then they have to come in, and we have to come in because we don't want to be like to be punished or whatever, because they can just easily send us home. So that was the fear, yeah. So of course, before the visa, and I'm like thinking, okay, let me just finish my adaptation, and be, like, because you're going to get your permanent contract, and said okay, and then probably I could probably talk back or fight back to them if that time will come. I've got family back home. I've got my dad and mom, and we are seven siblings. I am the fifth one. Um, the only thing, the problem really, at home is financial. So that's why I was really looking forward that that's the main thing that I could help my family, especially when my dad had a stroke. So he's like 18 years now, stroke, since we arrived here in the UK. So this is the thing that I have to do, the maintenance. And if they are like my mom and dad will be hospitalized, it will be my responsibility to send the money. So initially, my two brothers was like depending on me as well, like because their job, they've got a family to support. So like here I have to take loans, so I'm like, I loans here, because I have to send money. So anyway, I end up like, okay, I told my two brothers, because they're both qualified, electrical engineers back home. So I said, why can't you go abroad? I will pay for your placement, because like back home, we cannot go abroad if you don't have a placement fee, because that's the most required. So people are just selling their lands. If they've got their lands, they've got to put in a loan their houses to be able to get the placement fee, to be able to send their family abroad. So that's what I did. I said, okay, I'll finance your placement fee, and you go abroad. So both of them managed to get into it. During my adaptation, actually, I have no issues, because my mentor was really good. She really looked after me. She was very nice to me, so I have no problem with my adaptation so far. So we've got the library there to go, and because we are like a group, so we share each other and we help each other to complete our adaptation. But so far with my adaptation, I couldn't remember any hardship on that. The ward manager that we have was changed to a new ward manager. The problem starts there, because initially, I was like, after my adaptation, so, and then I become regular, and then my ward manager he moved to Scotland. So we have a new manager, a female manager, and I asked already our previous manager to be on nights, because I have a baby in the family, and my husband was working in a factory on where they have no night shift. So to be able to accommodate my child and my husband to work, I have to be on nights, and my husband will be on the day, so that the baby can be looked after. But then she was giving me a hard time to stay on nights. She keeps on telling me that, oh, you shouldn't be on permanent nights. It's not healthy for you. You should be back on days. And I'm like, but how can I, it's only me and my husband here. We don't have any family member here. How can we, maintain our family relation, especially to our child, if we are just going to leave him in a, in the childcare, and the childcare is really high, and my salary as a band 5 was not enough, like, to pay for him the whole week, or the whole, because it was still 5 days shift, the whole day for him to stay. I cannot afford that. But then she keep on insisting, and she was trying, and she even called me for a meeting, saying that, oh, you could, with your night enhancement, you could, or your salary, you could, pay the childcare of your child. But I said, it will not be enough. I said, I'm paying my mortgage. I have my husband salary is not enough to support us, so I have to stay on nights to be able to look after my child. And anyway, it was like constant, and even the my other colleagues have noticed that she was giving me a hard time. So I felt that it was time to raise the issue. So I've write a grievance against her, uh, about, like, I complained about her because she was finding faults with my job, and, like, the way that you have to go to work and say, okay, let me do this perfectly so that she cannot find any fault. And it's tiring to be like every day you go there, you're so scared that she might find faults on you. You might forget how to complete your intake and output chart. You forget to, but at the end of the day, I am a human being. I am like into mistakes with these things. So I think management can understand that, but it was like I was full of it. So anyway, I raised a grievance. The decision was like I have to move to a different ward because they cannot move the manager to another ward or move me. But then I come up into a decision. I said, okay, I'll just stay in my ward because the staff, are very supportive. We have a very good a relationship, together with the other staff because we've got like Africans, so Mauritius, we've got Kenyan, Filipino. So we are like international and we support each other. So I said, I think I could still stay, and I rather stay because I know the devil that I am fighting already. So that was my like, okay, I'll stay. But then later on, because I keep on banking on other units, so I was finding, oh, well, I think I'll be better to move to this unit because I really enjoy it, like in AMU, because you've got like your own bay, you've got your setup patient, you've got doctors there, so you are not really bothered about management more because you've got like your own world there. So I said, oh, I better go and work in AMU. I was really, really eager to progress. Yeah, imagine I've worked in that unit, in orthopedic unit, for 8 years. So on that years, we are really applying to become band 6, but every time we apply, we are failing. And then I even have like, because they were saying about English language, so I've even took. They've given me, it's like a course that I have to attend in one of the university. Yeah? And I attended a class of English and I passed it. But the result was like just emailed to the, I think she was still the matron before. It was emailed to her. I wasn't even given the result of that. So I have no chance to use it and show that, yeah, I passed my English, course that I've attended. So that's the only thing that I could remember, though we have still our annual, was this? Uh, Review, and we still have the study days that we get, like the fires, like all those courses that they offer every yearly that we have to do. We are hearing the news by December, about that. It started in China, so it was like that month, so December. But then, of course, I didn't hear until they were all worried about February. Yeah, so it's like February that we were informed that it was already, spreading here in the UK, and we are keeping on, keep getting an update for that. And then on March, my husband, he works in one of the unit, and he one day he came home and he told me that he nursed a patient 2 days ago, and he just and the test just came back positive, and he nursed the patient like with only mask because they didn't know that he was, or the patient was positive. And then after like 3 days, but initially beforehand, I have a tickly cough. So I'm like thinking, oh, and then on the third day, I was like having a temperature. So I called. I said, "Is this COVID or something?" So the manager was saying, "Oh, are you sure?" I said. So I explained to her what had happened. That my husband managed to nurse that didn't know that the patient was positive, and he nursed him, like with less use of PPEs. Said, "Oh, that's wrong. We should like he should have incidented it." So I said, "I don't know what was the protocol for them to do that." Anyway, but I said, I have a tickly cough, and I have like a slight temperature. And he said, "Okay, you have to isolate." So I was isolated for 7 days, but then like about 5 days, they were asking me already if I could come back. So I'm like, I thought like, 7 days, can I just complete and to make sure that I'll be well? And I said, okay. So anyway, after 7 days, I went back. So, but initially, I was sending emails to them asking what will be our PPEs, what will be the change. So I've been emailing my managers and whatever the position I cannot remember anyway, but I've been highlighting that, and then at on so I went in back again to work, and then on I think 2 weeks I've working, yeah. But they said there's no changes with PPE, still mask because we're considered in the community. So we are like using only mask, pinny, and gloves. That's the only thing. So I said, so we're not wearing goggles or anything like that. They said no, unless the patient is positive. I said, okay, so how can we know that the patient is positive? So anyway, after 2 weeks, I contracted. It was severely, I was even thinking that I'm going to die. So it was like, oh, can I just tell about being, like a governor in the hospital, that I was raising issue. This is before COVID. I was raising issue about our unit, about how understaffed we are, uh, about how bullying and harassment is being rampant in our unit. So I was raising that, and then the director of nursing was like not happy about that. That he even asked me to speak to me one on one, because he doesn't want me to raise it in front of the governors. So I was that, like being identified that, yeah, this staff is raising this issue, so I need to deal with her. So he even took me to went to my workplace and, like assess me, but he was just asking me how long I was working there, where I was working. So I was just telling him how long I was there and my background. And then after that, he didn't even, listen to the issue that I wanted to raise. I really felt that when I have the symptoms in the hospital, I was working. My colleague was like really concerned about me, so they have to check my temperature and my autosats, and everything was like dropping. So I said I have to call. I was still at work when I started calling 111, because that's what the policy was, called 111. So I have to start calling, and until I got home, I was still on the phone calling 111. Nobody was picking up the phone. So it was like an hour and a half before. And then when I arrive home, I have to strip all my uniform, put it in a bag, leave it outside, and then I went straight to our room. So I said I have to isolate. I told my husband I have to isolate myself because I have a high temperature and I'm very short of breath. So being alone in the room is really, really scary. I am thinking, because seeing the news on where most of the people are affected are colored, like our like Filipinos and Africans, and I'm always scared seeing them, because some of documentaries that they will show that the people are just dying in their room, in their bedrooms, and even if they call 999, nobody will come and take them, because the hospital, they said just to isolate yourself and stay at home. So I was at that point that, oh my God, I'm going to die. And I'm thinking that, oh dear, am I going to see my family? And then I asked for the iPads. I've got chargers, at my in our bedroom, and I'm like, okay, let me just call everybody. But then I was documenting myself and saying that here, this is my first day, just to monitor how I will go. I said, if ever I will die, at least they have something to look at me in my mobile phone. So I'm like, at least I could document, and even I could even say goodbye if I'm really feeling that I'm going to go. I'll just say goodbye, and at least they have something. So I really feel isolated. Obviously, I don't want my kids to get it, and my husband. So my husband has to cook for me and bring me. And on that night, I was calling 111, and about after an hour and a half, somebody phoned me. It was like a screening thing that, oh, what's your symptoms? It's like this, it's like that. And they said, oh, I said, what I'm going to do, about my work. They said, you've got to call. So we have like a silver command that we have to ring. Is it is it a different thing, or I could say that, yeah. So we have like this command thing that we have to ring. So when I rang, the lady on the phone was even saying, ha, like laughing at me, like, and I was struggling to breathe already. I said, what am I going to do? I said, can I have a swab just to make sure that this is COVID? Because if this is COVID, I need to prepare myself. If I'm going to die, then at least I could, say goodbye to my family. But I said, oh, you really have to, I don't know why you contacted us. You should even contact your ward manager. But I said, my ward manager is on sick. She also have COVID. So I said, oh, what I'm going to do? And I really felt that I was like ignored. I said, hello, I work as a staff governor. I am your employee. I said, I am asking for help, for me to be swabbed, because I just wanted to have it on my mind if it's positive or negative. That's all I wanted. And then they said that, no, we don't swab. You have to contact your first line of manager. So I keep on looking for all the numbers on whom I could contact. So, and then I was communicating with one of our directorate. She texted me, and they said that, oh, this director of nursing is going to call you. And I'm like, okay, why is he going to call me? So it was like a thought. So, and then I emailed anyway, because I complained about that staff who was laughing, not really laughing, like chuckling when I was telling her about my symptoms, and I was struggling already, and you're chuckling at the end. So I complained about that. I sent an email complaining about that staff, and I received an email back saying that they're apologizing about about the attitude of that staff. So anyway, I was expecting a call from the director of nursing, and then he he texted me, or he emailed me that he will not be able to call until later. So I have to contact one of my colleague who is a doctor. I was asking him, what am I going to do, what things I have to prepare for myself, what am I going to take, so I was watching YouTube about deep breathing, about all sorts of things. What am I going to drink? So anyway, after 2 days, but then I've seen my my ward manager and one of the higher uh, personnel, in the community. They were posted in the. I even screenshot them because I wanted to show that I am not, telling lies. There's an evidence that I kept that they did swab during those days. So my ward manager was swab, and she was saying that, oh, I'm tested positive. I had my test, and it was in the in Facebook. So like, oh, that's good. So we were even messaging there on the Facebook that, why are you getting your swab? Why are we not being swabbed? So most of the staff there was questioning her, and she was saying that, oh, we cannot discuss it here, this is like, so she then, I was answering her, why are you posting it then if you don't want anybody to question you? So she was not happy with me because I was questioning her. So I was questioning my ward manager about the swab, but then she said that she cannot discuss it because we are like in social media. So anyway, at that time then, when, oh, this is after now, yeah, but beforehand, as I was waiting for the call for the director of nursing, uh, he phoned me. It was like, I think, 9 o'clock at night already. I was in bed. I was still struggling to breathe. And I'm like, he said, oh, I said, sir, can I have a COVID swab? I wanted to be tested. And he said, oh, you've got all the symptoms already. So there's no need that you need to be swabbed. I said, but I wanted to be confirmed if it's really, so that I could prepare myself. That if I need to fight, then I could fight it. Whatever circumstances, whatever I could do, I will do it, because I know that this is COVID. But he said, no, because you've got everything. Then why is it? So I questioned him. I said, why is it then that uh, the other staff are being swabbed and why I am not being swabbed? And I said, well, this is not, like the point of discussing it to you. So he said, but I cannot authorize you any swab for you. So he didn't authorize even the one in the community who was texting me saying that, I will arrange for your swab, but then the director of nursing refused for me to be swabbed. So I wasn't given the chance to be swabbed. So I have to deal with it and just, try, me and my husband try our best to conquer it. Like, I always talk to them in the iPad, my children, they can't even hug me, and they always check on me on the iPad. We just talk like that. And it was very, very scary moment that I said, but I was really praying hard that no, this is not my time yet. I'm not going to die on this. No, I was really fighting. I have to do my deep breathing every 10 minutes. Stand up, deep breathe. So 10 minutes again, lie down. I have to follow like the advice that you need to lie down. I have my Vicks Vape Rub. I have lemon, everything that I could think of. That I said, I have to survive. I'm not going to die. No, it's not my time to die yet. So I have to fight. So anyway, I did survive it. I did survive, and then after that, because I was still short of breath for 7 days. To So I was like, please, can I just have a swab? So I just really wanted to make sure that this is COVID. But then I was still declined. I cannot have a swab. And then there's a point that my husband got the symptoms. And he has to ring that command thing. And then they said that you need to ring the manager. So he rang the overall manager that day. And he said that, oh, are you the husband of me? Are you the husband? And they said, yes. Oh, hold on. Okay, I'm going to ring you back. So he waited because he got the symptoms as well. So we waited. So we're thinking, oh, but I was saying to my husband, if you could get the swab, just get the swab. I said, me, I will. It's okay for me. I'm not going to get. But I was looking for options. Like, I was even posting in social media where I could get a private swab, and people were very supportive. You can go on this, you can pay this, you can go on this site, to look for, so that you could be swabbed. And they're all like, why are they not swabbing you? I said, I don't know. So that's the thing, that when my husband ring, and then the overall manager, that they said that he's going to ring him. And then when she rang, he confirmed again if he was my husband. And of course, he said, yes, I am. And then, oh, I'm sorry, we cannot give you a swab. We cannot swab you. So I don't know. I said, why is it that I know if I am like, in I if I am raising concern, it should only be me. They shouldn't include my husband because at the end of the day, my husband also works for them. So I'm like, oh my God, we need to find our way. We have to find our way. We cannot like sit here and not know what is going on. We have to find a place where, so we were asking. So we find a place. We said, oh, there's a place there that you could go. Just bring your NHS ID and they will accommodate you. And I said, okay. So but it was an antigen testing, the first one that we went. It was a private one. So we went there. We have the antigen check, and it come back like, it wasn't COVID that I had. But then after a week, so we tried again, and then somebody said that, oh, there's a public swab going on. You just need to bear with the queue because it's quite a long queue. And you could also just bring your, I said, do we have to book in, like the ring? No. She said, just just bring your badge. So we went, me and my husband. So we put our badges in front of our car, and we did have the swab. And then after a day, and it all come back positive, both of us. So I was just so relieved that we have the confirmation that it was really COVID, and we are not like just saying that, we are sick because we have the symptoms. It was confirmed. So it was the feeling that, why did they did it to us? Why is it that we have to suffer like this? Why is it that some of the people are being swabbed, and why is it? What's the reason behind why we are not swabbed? Is it because we are not the top bosses, or is it because we are different color, or you cannot really tell what's the reason behind. And then I complained about that, and then later on, after I complained, they went into my thing, and they were all complaining about me, and they were trying to get me out, kick me out. I was i was accused that I don't know how to report my sickness. I was accused that I don't know what's the PPE all about, because I was questioning and telling the NWAS or the ambulance that these are the PPE that we've got, but that's the PPE that we have. What we have a different PPE. But then the higher person was saying that I don't know, like I am divulging information that is not true, and I don't know what like my role is as a band 6. And I'm like, oh my God, what's going on in this hospital? During the pandemic, what I could remember that was really, really disturbing is, of course, the people and the colleagues that are dying. I think we have like one or two member of staff in the main hospital who passed away, and I think one was Filipino, but she was like a retire already on the retiring age, and she got like several comorbidities. But thinking about those dying people and seeing it on the TV, on the news, it was really a scary time. And I even have a very close friend, and she was tested positive. And for that, before she will be swabbed, luckily the husband is working in one of the area where the husband got like connections with the doctors and consultants. And I think they managed to go to the management higher to approve her swab. So she had a swab, she tested positive, she went into the hospital, she was admitted for almost a week, and she was giving up already. And because that she was a colleague, and the people who were looking after her was really insistent for her to get the treatment, but she was like refusing. And nobody was even they're all like was scared to go in and look after her. But then one of our colleague who is from Uganda, because she knows her and we know that she was an old colleague, so she insisted that I'll go in and look after her. So she went in, and everything that she does, she was refusing. She was calling me, please, can you speak to your friend not to give up, because she's giving up. She don't want to use oxygen. She don't want to go to have the what's that uh, before the intubation, the oxygen CPAP. So she's refusing to go to the CPAP ward to be. So we're like, can you just think? Because she's lacking of oxygen to her brain. That's why she's refusing. She's confused. She don't know what she's saying. So please fight for it. And then during the handover, she didn't know that it was her. But then they were saying that, oh, she needs to be DNA'd because she's refusing the treatment. And she said, is this the colleague that I was working before in the unit? She's going to be dinner. No, 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 we cannot do that. So she fight for it. And she was even insisting to the consultant that she needs to have an MRI in the lungs to make sure that, everything is okay. But then one night when she was on, I think her phone was ringing and my friend was not answering the phone. She wanted to go. She said, I cannot bear it anymore. She said, I wanted to die. I said, no, please keep on fighting. I said, we still need you. Your children need you. Your husband needs you. You cannot give up like this. And then one day she didn't answer any call. And then the phone was ringing and ringing. And then that friend of ours went in and she just answered the phone for her. And luckily it was like, I think it was the the youngest son who was saying, Mom, please, can you fight and go? We need you. So my friend, then I think she managed to think that she has to. So when she agreed, she said that, okay, I'm going to the CPAP ward. So they just hurriedly get the wheelchair, put her in the wheelchair, and they didn't wait for the porter to push her. They just push her back to the CPAP unit so that she will survive. And she did, and she managed. And she pulled through with it. And we're just so happy, about that. I even promised her that, oh, I'm going to cook for you if you're going to go home. And she was discharged, and I did cook her favorite dessert, and she enjoyed it. And I'm still working with her today. We're still working. Well, with regards with the compensation, we're thinking that life has no amount to offer. But being considered like to be as a human being, for respect to give what we need and to understand, what we want. It's all about like caring for your staff and let them feel that you are part you know of the family or of the community, that you have to be looked after as well, that thinking that we are human beings and we are equal for me, like we are all equal in the eyes of God, and being created like you bleed, I bleed, you eat, I eat as well. So what food you eat, I also eat. So we are like, there's no amount that can pay for the life of who died during COVID. But the only thing that money can at least support the family, I think it wasn't enough. It wasn't enough because at the end of the day, every time we go and nurse our patients with COVID, there's always like 50 of your half of your life is already there in the grave and surviving it, and just to think about it all the time. I just pity, and I could just feel all my colleagues that are working in the ITU and the respiratory units with all those things that they're putting in themselves. It's always it's always hard. I keep going because I have faith in God and the love of my family. I always say that I'm doing this for my children because they will live here in the UK. I might be gone, but I have something for them to say that my mom fight for me, fight for my equality, fight for me not to be treated like she was treated before. So that's why I keep on fighting, and I keep on believing that someday, one day, we will be all equal and we will be treated fairly wherever we go. COVID really affected me so much because every time I will look into myself that I was suffering and nobody was listening and nobody was giving me the chance to be like uh to get what I needed that time. It affected me. I'm very, very scared nowadays. My anxiety is really high. I don't suffer with shakes before, but now every time somebody will, like even just talk to me in a bad way, I will shake and I will reiterate and I will answer back. It gives me strength as well, I would say, because I always think that you cannot do this to me anymore. I suffered a lot. I've been here for 18 years and you're still doing this to me. And still, I could still see people suffering as well. And I cannot take it. So it's so emotional. I have to go undergo emotional support. I have advisors. I go through with that just to keep me, you know, uh, moving on. I have to express myself. An advisor is always there to listen because not all of the things I could share with my husband, because I wanted my husband to be tough. And if I keep on bombarding him these things, I'm thinking that I think a professional can help me rather than my husband and my children. So I have to seek help. And our hospital has been, helping me as well so far. But after sessions, I think I had like 3 sessions for this. Helping each other is was very important, and I'm very happy and I'm very glad that I belong to the Filipino community because we support each other. Everybody was like checking each other. Uh, One family will say, "Okay, do you have food? Do you need this?" During the pandemic, racism was really rampant because, as you could say, uh, some of my colleagues were being, like moved to the high risk area compared to the area that we were working. They were not given the choice where they want to work. They always say you are contracted in the hospital, you are not contracted to any ward, so you can go. And then several people's work in that unit again and again, and you can see that always these people is working there, and even they say that, oh, it's a rotation, that like this group of people will go to that area, but then it didn't happen. So they're saying that it's only like temporary, but then come 6 months, a year, they're still there. But then people are scared to say something. They're not that tough, I would say, like me, to voice it out. I tried to raise it as well, thinking that I could help them. But I think now, I don't know when it started. They just started them to disperse to the previous ward, but they were there, you know, every now and then. They're the same people that's going in. And then even the high risk people, uh, they have no choice. Even my husband, who is very high risk, he has to work in that COVID ward every now and then if there's no staff. So it's like same people are going in. I've been in the trust for 18 years, yeah. And I've been applying for band 6, and I got only the job when I resigned, and I went on full-time agency. And then when I went into interview for my band 6, for that 15 years, I wasn't offered if I wanted to progress, though it's always in the PDR that of course we wanted to progress, we wanted to be band 6, of course we wanted to be managers. But on that time, nothing has been offered to us. Some people are just saying that because you are permanent nights, or because you're working mostly on nighttime, so there's no chance. So we were saying that, oh, you have to work days before you could get this whatever courses, but nothing has been offered, to be honest. Though they were saying that there are things, but we don't know. They said that you need to let your matron know that you need to go into this, but nothing really specifically saying what courses we can go and what they can help us to progress. Nothing. And so with my band 6, I have to resign and be an agent, full-time agency first, and then reapply after 1 year. And then even during my interview, they were asking me that, oh, if we cannot offer you the band 6, can you be a band 5? And I said, excuse me. I said, with my salary as an agency, I am earning more than band 6, but I wanted to be like band 6. That's why I applied for this job, and this interview is for band 6, right? I said, what else do you want from me? What experience do you want from me? I said, I've been here for 15 years, you know. I said, I think I wanted to know really why I will not get the job if this is the case. I said, I've I've answered the question anyway. So what's the problem? I said. So anyway, well, we're just saying that if in case there's no band 6, if we cannot offer you the band 6, could you work as a band 5? I said no. So when I work as a band 6, they put me down as a band 5 start, a band 6 starter, and that was lower the rate that I was on because I was top band 5 already. But because they wanted me to put on band 6, they put me on the band 6. So it was like me, the band 5 rate. I just take it. I said, okay, let me just take it. I'm just desperate for my job. I just wanted to be band 6. I cannot bear it to see that my student, how many students I have, they are higher than me. We arrive in this country. They're matrons already. How did they get to that? What happened to us? What's the difference with us? Is it because we cannot communicate in English or what? But we can communicate. We can nurse our patients. We can give what they need. Yeah? We care for them. But what else? What is lacking with us? This is always my question. Why is it that my colleague who is working there for 18 years compared to this 1 year and 3 months nurse become band 6 and them they cannot get it? Why? For all the new Filipino nurses that are joining us here, I encourage you to be tough. It's not an easy journey to be a nurse here. It's not. But to be more proactive, that they need to express themselves. If they are hurt, they have to let them know that you're hurt. If you need something, you need to express yourself and say it. And it doesn't matter if your English is crooked or not. At least you can speak English and say, hey, I'm not okay with this. Is it all right to change? Is it okay to, how can we make it for me to be comfortable? Express yourself. Don't be afraid. Be tough. But I don't know, people sometimes are not tough. But To you all new nurses, please express yourself. Show them that you have the right as well, especially in progression. You have to fight for it. It's not just sitting down. You've got to do something. Yeah, just be tough and be positive.